Imbalances of the micromineral household in ruminants. So milk fever, also known as hypocalcemia, occurs in high-producing dairy cows, especially those over 5 to 10 years old. It's rare in heifers. It occurs immediately after calving, so within 1 to 3 days. The cause is an old cow due to decreased utilization and decreased PTH receptors, or giving too much calcium before birth, which decreases PTH, which will cause a decrease of no mobilization. Or if the cow has a positive cation anionic balance. So if they have decreased calcium and decreased phosphorus, this will increase the neuromuscular irritability, as well as an increase in magnesium. For the pathogenesis, they need to have a relative or absolute decrease of PTH, which will cause a decrease of vitamin D activation. This, as a result, will decrease the mobilization of calcium in the bones, and as a result, it will decrease calcium absorption from the GI tract. And this will also increase calcium excretion within the milk. For the clinical signs, you'll find them in sternal or lateral recumbency. They can also have tetanus or opistotomus or coma. It frequently leads to Downer cow syndrome, which is muscle degeneration and necrosis. For the diagnosis, you check the total calcium. The normal calcium is 2.5 millimoles per litre, and when there's milk fever, it's less than 1.5 millimoles per litre. When carrying out the treatment, you need to give calcium gluconate. You give it intravenously slowly. However, this can also cause a paravenous calcium infection, which can lead to phlebitis and necrosis. You can also give a calcium paste. You can give it orally. For prevention, make sure the cow is in a negative CAB. So in the last week of gestation, the last 3 weeks, you need to decrease calcium, as well as supplement vitamin D3, and then give a calcium bolus after calving. For hypomagnesic tetany, so the normal magnesium is 0.8 to 1.5 millimoles per litre. However, in the case of grat tetany or transport tetany or calf tetany, magnesium will decrease as potassium increases. This is due to fertilizer or decreased magnesium, which will cause decreased magnesium absorption, which will increase the ruminal nitrogen and cause stress. And the signs are weakness, anorexia, tetany, and coma. And for transport tetany, it's way more common in pregnant cows. Transport will cause stress, which will decrease magnesium. And in calf tetany, it's due to poor magnesium in the milk, which will cause whole milk tetany. And for the treatment, give commercial magnesium.